Well, before we had the NMDSSC, which is the data collection for adult social care in England, that's skills for care managers, David Bean, who at the time was, I think, relatively new as the Director General for Social Care, described our sector as a data desert because we actually had no information about the workforce. And now we're in a position where we've got over 60% of CQC registered providers putting their data into the data set, and we've got worker records on over 800,000 individual workers, and that gives us a rich seam of intelligence to mine to be able to provide information to the department and to work with them on the analysis of that information, and to work with yourselves as the Centre for Workforce Intelligence and also with the Information Centre to think, well, what's this actually telling us? So we know, for example, that currently we have 1.56 million workers in our sector. That's a workforce that's bigger than the NHS, but we also know that we're going to need at least 500,000 more workers by 2025. And that's quite a significant challenge, especially when you think that on any one day in our sector we have 60,000 vacancies. So we've got a huge amount of work to do, and I think this was reflected in the discussion that we've had this evening about how we can really raise the profile of our sector and say to young people, say to people who are maybe thinking about a career change, or even people who might have finished their primary career but want to do something useful and productive. Think about a career in social care. There's so much that we can offer. There's a huge range of opportunities to develop skills, to gain qualifications. In and of itself, it's a really rich, rewarding role. There are so many different roles. There are so many things you can go into. If you're young and ambitious, it's a fantastic career pathway. You can come in as an apprentice at any age and get training on the job. You can be a care ambassador. There are many, many wonderful things, but we've got to do more, I think, to get the really positive stories about social care out there.